Hello, everyone, and happy Friday and happy Labor Day weekend. Well, we are bringing you our daily episode. Today's episode is focusing on diabetes, specifically for women who are in their mid 40s or 40 and above. We know that women, when we as women reach at that age group, we are into perimenopause and menopause and beyond, and we are susceptible to getting chronic conditions such as diabetes, cardiovascular disease, osteoarthritis, and dementia. So today I wanted to focus on how to prevent, and if God forbid you get diabetes, how to manage it with Dr. Hegde. Dr. Hegde is an Ayurvedic physician joining me live from Bangalore, India. Namaste, and thank you so much.
Yeah, namaste. Hello, everyone.
Okay, so I know you've talked before on some of the conferences on diabetes and herbal diet plan. Do you want to focus a little bit with the focus on the mid-age woman here and how diabetes can impact the women at that age?
Yeah, sure. So usually women when they are pregnant, so usually that is the time where most of the women develop gestational diabetes. So because of the hormonal imbalance and because of not enough to take insulin capacity and all, so there is a more chance of developing gestational diabetes during the pregnancy. So other than that, there is one of the most common risk factor which we say where the woman can develop the diabetes is overweight or obese. So usually what happens till 35 to 40 years, women used to maintain the body shape. Women used to do some exercise or they used to go for some fitness regimen and all. But once they get a child and once they are completely busy with their family or their work, etc., so they used to lack of physical activity, they are not they even though they want to do some physical exercise or they want to modify their lifestyle, so they don't get enough time for that because of lot of responsibilities. So usually what happens, many women, like if they are not working outside, if they are in the house only, they are housewife, so usually they sleep in the daytime, and because of daytime sleep, usually there is a more chance of getting obese, getting overweight. So that is one of the main risk factor where we can say that mid-age women usually get the diabetes. And other than that, one more thing is birth control pills. So usually nowadays, if the woman is having PCOD, or if she's having PCOS or any menstrual related problems, so usually many doctors advise to take birth control pills. So when you take it for a long time, so definitely it will help. It will causes the development of diabetes. And other than that, the risk factors, if the woman is older than 45 years, and if there is a family history of diabetes, like if their parents or if their siblings are having diabetes, or if she's having a baby which is when it is born, if it is more than 9 pounds, so there also she may have a chance of getting diabetes. And other than that, if she is having high cholesterol or if she is having high blood pressure, so then also she may develop diabetes. So these are some of the risk factors which we can say where women can develop the diabetes. So mainly it is because of the diet and the lifestyle disturbance.
Okay, so that is actually very alarming because you are pointing out that it doesn't happen suddenly. I'm over 40 or I'm in 45-year-old, someone is a 45-year-old and suddenly they're going to get diabetes. That it doesn't
Yes,
happen like a
yes,
switch, right?
yes,
That's what you're saying. It happens when all of us are at a younger age, when maybe we're having a baby, kids, during the time we have not been taking care of ourselves. Over time it starts progressing and hormonal imbalances start
yes,
happening. And when the perimenopause hits or the menopause hits, your estrogen and progesterone is going down anyway, now it gets all exaggerated, and now there is a more risk of chronic condition, right? That's how I'm understanding. Do you want to
Yes.
clarify a little bit?
Yeah.
Okay. All right. So now that it has happened, let's say someone's got diabetes because of their bad lifestyle and because of all the things that you pointed out, right? What should they do? How should they manage the using Ayurveda as one of the main toolkit and herbal
Yeah.
management?
So, diabetes is one that condition where we can go for the reverse treatment. So, if the diabetes is related to the irregular diet and lifestyle, so we can reverse it with following the proper diet and lifestyle. So, many of us know what all diet to follow when we have diabetes. So, in that also for the woman, timely food is one of the very biggest challenge we can say. If she's having a lot of members in family, or if she's having lot of responsibilities, so usually she will she her timings will be disturbed. She won't be having a proper timely meals and all. So that is also one of the reason for the diabetes. So in ayurveda everything is connected to the digestion system. So whatever disease happens or whatever disease forms, it is always connected to the digestive system. So even the diabetes also, it is connected to the digestive system. So if your digestion system is very strong, then definitely you may you can maintain your health in a good state. So that is one which I can advise, that try to follow a timely meal, or try to follow, like if you are having try to follow the timings for your breakfast, lunch and dinner. And other than that, try to practice at least 15 minutes of exercise in a day. So we can say it is a me time for the woman. So at least 10 to 15 minutes she should give for herself. She can practice either Surya Namaskara, or she can practice some yoga asanas, or she can practice some stretching exercises, or she can just go for a walk. So like that, at least 15 minutes she should do some physical activity or physical exercise. Even though we can say while cooking, or while taking care of babies, or while cleaning the house and all, so we are doing physical activity. But there actually, even though we are doing physical activity, but our mental status is not involved in that. So that's why at least 10 to 15 minutes we should keep for ourselves, and we should think, and we should do some meditation, or we should do some lifestyle correction, doing exercise and all. And other than that, usually what happens now, for example, today we prepare some food, and if it is remaining for the next day, so usually women used to eat that. We should not waste. In India, most of the women are having that typical mind. So they don't want to waste that food, and they will eat that. So what happens is, when you eat the remaining food, which is cooked previous night, so it will be having the moisture content. It will be having more of moisture content, and because of that also the digestion system will become weak. So that's all. We should, yeah, one is definitely we should give time for ourselves, and the next one is we should follow a proper and healthy diet, like timely diet, and we should have some physical activity, like we should do at least 10 to 15 minutes of exercise, meditation or yogasana, especially Surya Namaskara. So at least 8 times if we do Surya Namaskara, so that would be very beneficial for the woman. Even though it is not only for diabetes, but for all the health conditions, it would be beneficial.
So no, I think those are general. That's really good idea, and we know that yoga is very effective, right? But I really want to focus today on Ayurveda, the type of panchkarma therapies, the type of imbalance, whether it's Vata, Kapha, and Pitta. What specifically to Ayurveda? What is the imbalance that is caused? That's number one. what type of therapies Ayurveda talks about, right? So can you talk a little bit about that specifically on
Yeah, yeah.
Ayurveda, not on yoga?
Okay. So in Ayurveda, like when we see diabetes as a disease, so it is actually categorized into Vata, Pitta, and Kapha, all the three. So based on the symptoms. So if the person is obese and if the person is having the symptoms like laziness or frequent urination and all, so it is related to the Kapha. And if it is like if the person is having burning sensation, acidity, etc., it is related to Pitta. And if the person is having in frequent urination and in between symptoms, and if the person is thin, so that is related to Vata. So what happens is yeah, again based on the symptoms, doctors can decide which type of diabetes it is. But usually diabetes is compared with madhumeha in Ayurveda. So madhu means honey and meha is frequent urination. So in Ayurveda, the diagnosis of diabetes is when you urinate, when you pass the urine, if the ants come and if they surround the urine, so then we can say it is a diabetes or it is a madhumeha, because the urine will be very sweet in nature in the diabetic person. So that is the diagnostic criteria if we say in Ayurveda. So in panchakarma, there are two different types of diabetes or prameha is mentioned. So that is, one is stula and one is krasha. Now, stula means obese. If the person is obese and if he develops diabetes, and the one is krusha, that is if the person is lean or if the person is thin and if it develops madhumeha or the diabetes. So here, based on the patient's strength and disease strength, we can advise the panchakarma. So usually all type of panchakarma, that is five purificatory procedures, can be advised in diabetes or in prameha. But the only thing is we should understand, or we should uh, examine the patient's strength and the disease strength. Because panchakarma is when we say it is it looks very easy thing, but when we do it, it's very difficult, because in that procedure, the person should completely give his 100% to that treatment, otherwise there will be no effect. So in that also, first few days we will give the digestion related medicine, and then we'll give medicated ghee on empty stomach. So once there is a features, like if the person gets oily skin and if the person gets very oily face and all, so then we will understand, yes, the person is completely moistened from inside. And then we will go for the full body oil massage and steam. There also, if the person is having BP along with the diabetes, then we try to avoid the steam. And after oil massage and steam, we'll give one medicine. So the medicine, like, it depends on the dosha. Like if it is vata dominant, then we'll go for the enema treatment, that is through the anal canal, through the rectum. We'll give the medicine, and the person should pass the motion. So he will pass all the toxins through the motion. And if the pitta is dominant, then we will give the medicine will cause the purgation, so he may pass 20 to 30 times loose motions. And if the person is kapha dominant, then we'll give one lehya. So after that he starts vomiting, so then again toxins from the stomach it will come out. So again it depends on the dosha, dominancy of dosha.
Okay, so so it is very personalized. That's what I wanted to point
Yes.
out, right? The step number one from Ayurvedic perspective is to understand the dosha, and then depending on the dosha, specifically the medication, or it's the panchkarma therapy, which it can be a bit difficult, but it can be managed, right? Ayurveda
Yes.
can help manage diabetes, but even
Yes.
after all these therapies that you're talking about, whether it's panchkarma or some of the medication, the woman also still has to maintain herself after that and change the lifestyle. There's no magic that's going to happen, right? Do you want to comment on that? Because it's not just like one time you do ayurveda and now you're fixed. You have to continuously manage, improve your lifestyle, right?
Yes. So yeah, actually, after taking panchakarma treatment, definitely they should follow a proper diet and lifestyle. Then only that's beneficial, because now after doing panchakarma, if they again start like having all type of food items like aerated drinks and pancakes, pastries, even white sugar, white flour, etc. So again, it may develop or it may progress also. So that's why in Ayurveda it's already said that if you follow a proper diet, you can maintain a good health, and if you don't follow a proper diet, then you don't maintain good health, and there is no use of medicine also. So that means if you are taking medicine and if you are not following the proper diet, then there is no use of medicine. And if you follow a proper diet, then there is no need of medicine. So it is already said in Ayurveda. So that's why even when we are taking medicine, also we should follow a proper diet. Then only we can fix it and we can maintain a good health.
Okay, I think it's a great way, the way you explained it. It's beautiful. Thank you so much. I just wanted to bring that how women, when all of us get at a certain age, it's not just suddenly a switch is going to turn on and then we're going to start falling off the cliff. Our health is going to deteriorate. We can still have a very good health and maintain ourselves as we start aging if we take care of ourselves when we are younger. And as Dr. Hegde has pointed out, it starts when we are in our 20s, and the hormonal imbalance continues when we get into our 40s. But even after that, having a good lifestyle, a diet, and exercise regimen is critical for us to age well, and of course prevent chronic conditions such as diabetes, which we are talking about it today. Anything else you'd like to add? I really want to thank you, and thank you for everyone for supporting us. Anything else you'd like to add, Dr. Hegde?
Yeah, so I think, yeah, for especially for women, try to give yourself a time in a day, like at least 5 to 10 minutes. So just self-analyze yourself. So what is lacking and what is where you are getting more stressed, or where you are overthinking and all, so that you can understand what's happening with you. And I think you can make your life better with yourself only, because in women life, so they don't care about their self always, they will be having lot of responsibilities, and sometimes they forget what they want also. So that's why in a day at least 5 to 10 minutes definitely they should give time for themselves, and they should self analyze, and they should realize what is needed and what is not needed. So that is,
Absolutely.
yeah.
Yeah, no, self-realization is very important, and you don't need to realize when you are at a certain age, when you're, suddenly your kids are
Yes,
gone, and now you say, okay, now I can start living my life. That's not
yes,
how
yes.
it should be for all of us women. We as women need to start living our life when we are early on, starting from, younger age to all the way when we hit the post-menopause or whatever. Thank you so much, Dr. Hegde, for educating all of us. To everyone else, have a great Labor Day weekend. Keep supporting us. We're coming up with holistic plans specifically for women, with women focus. So stay tuned and keep supporting us with that. Thank you so much.
Thank you.
Bye-bye.
Thank
Namaste.